the media. First of all, allow me to thank all of you for coming out this morning and to welcome you to this engagement with His Excellency the President. I'll now turn the mic over to His Excellency for his remarks.
Thank you, please. Thank you. This morning, I really want to spend some time with a sample representation of our doctors across the country, not just the Georgetown Hospital, but our regional health care system, to really engage you on where our healthcare system is heading, where we want to position the healthcare system, and how we align our human resource assets in you, the doctors, the technical people, to this vision, and how we ensure that the infrastructure investment that we're making now would be optimally utilized and matched with the human capability and capacity that we have in the system. So this engagement really is to bring you, all of you, up to speed with where we are, to discuss with you some of the opportunities, and to have your feedback. And importantly, for you to go back to your institutions and your doctors under your command, and have a discourse with them on where we are heading and what is expected of the sector. So after these brief remarks, we will then have a closed session. I'll ask all the media to retreat, and we'll have a closed session. Because I believe that we are making serious investment in the healthcare system, and in making these investments, the population and the government expect that in a short time span, we must be able to deliver efficient, reliable, quality healthcare, world-class healthcare to the citizens of Guyana. In the first instance. In the second instance, our healthcare system must be developed to be the premier healthcare system in the region. And thirdly, we want to structurally integrate our healthcare system into the economy of the country as an important revenue earner in the future. So these investments and the expansion of the infrastructure, both in the public and private healthcare system, are around these core principles. But I believe that we have never had the opportunity to have an elaborate discourse with you who are practicing in the system, who no doubt are seeing the evolution, the new equipment, systems coming in place. So I wanted to have your take on development and your understanding of some of the things you believe we should pay attention to. It is only in this collaborative approach that we will be able to build a system where the practitioners own the changes, own the system, own the modernization. If we don't create the ownership from all the stakeholders, then we'll not be able to derive the results we want to achieve. So you, the doctors, must own this vision, must feel integrated in this vision. Over the last 3 years, we have been making steady progress in the expansion of the healthcare system through infrastructure, facilities, equipment, and modernization. With this, we have seen an expansion also in the services that we are offering in the public healthcare system. Outside of that, we have seen that from a policy perspective, there are some key areas that we are addressing on the primary healthcare side, and then also on the treatment side, the approach to dialysis, the approach to cervical cancer. We'll launch very soon a national approach to testing for prostate cancer. And once we do the tests, then the evolution is that we have to build the facilities and infrastructure to advance care. We have had, in the last 3 years, many partnerships, but our primary partnership is with the Mount Sinai healthcare system. And the objective here is to build our healthcare system to a point through which the Mount Sinai brand can be confidently attached to our healthcare system. Now, save and except the few public reports in the newspaper on some of the challenges, maternal death, a few, the public does not get to see the exceptional work that you're doing, the medical professionals are doing across this country. Exceptional work, because I've had the opportunity to look at all the reports on the challenging circumstances. But exceptional work can be destroyed very easily with level of service. And the level of service range from all the stakeholders in the delivery of service, from the security that opens the gate, to the clerk that collects data, the nurses, the cleanliness of the place. I've had the opportunity, unannounced, a few times last year and this year to visit the Georgetown Public Hospital Corporation. And I can tell you, I've seen the marked changes in the environment, the service, and this is developing into a prime example as to how all our healthcare system must be and should be. I want us also to strategize by building a team approach to healthcare in all the regions. Not a compartmentalized approach, but an approach through which we can have emergency, pharmacy, services, everything, maintenance, as a team, moving through all our facilities in the region and working out strategies and plans as to how we will upgrade those facilities. So one of the things that we are doing in this year's budget, for example, is that we have set aside resources to make users of the services, whether it's at the healthcare level, the regional health services, or the hospitals, to allow them to have better experience, ensure they have proper washroom facilities, ensure they have proper waiting room facilities, ensuring we paint back all the buildings. The worst thing when you're not feeling well is to go into a place that does not look well itself. So we are working on upgrading all the facilities throughout the country, putting these basic things in place. We're also working on establishing a customer response mechanism. One of the things we're thinking about is to have a call center approach, where if a citizen go to a health clinic or a hospital and they're dissatisfied with the service, then that citizen can easily call through a call center approach and make their complaint so that we can have a more professional and efficient system and a more responsive system to the needs of people. So this monitoring mechanism is also very important in the system we are building out. Now, we have to agree what constitutes public service. Now, I don't have any difficulty with your talent being utilized in private sector, in regional health care. But I want us all to agree that once we're in the public health care system, there must be a minimum standard and a minimum set of deliverables and hours that constitute our support to the public health care system. I'm not going to be the person who would run down doctors. I believe that we can find a healthy balance. I believe that we can work towards finding a solution that maximizes your potential. Well, you may say maximize your earning power, but I want to say maximize your potential, because if you're specialized and if you have capacity and capability that the country can utilize in a maximum way, that is what I want to focus on. How your talent is maximized without injuring or without affecting the delivery of healthcare in the public healthcare system. These discourse requires a level of maturity and requires us to be open and for us to be transparent. That is why in the closed session, I want to address these challenges. The investment we're making at Georgetown Public Hospital Corporation, for example, will see us having state-of-the-art forensic labs, biochemistry labs, pathology labs, and also we are advancing care now in terms of surgical intervention, the level of surgery, the type of surgeries, the type of equipment that you'll be getting. But we have to seamlessly integrate that also in the investment that the private sector is making. We have been receiving a number of requests to support our healthcare system from different stakeholders. I want us together to agree which are the key areas. If we have a backlog in a specific area, which are these areas? And which areas do require us to bring in specialized help so that we can clear those backlogs? I want us to spend time clearing backlog, especially issues that affect women and children. I want us to identify the areas of backlog, and we are going to invest in clearing those backlogs. At the regional level, as you're aware, we are building a number of regional hospitals that will be of different level of service, which require greater degree of management at the regional level, greater skill set at the regional level, and these investments and the type of equipment and modernization that is coming with these investments should reduce drastically the workload at Georgetown Hospital or the referrals to Georgetown Hospital. So the regional level, we will have state-of-the-art hospitals. At the sub-regional level, we'll have state-of-the-art hospitals just below the regional standards. But we have to now identify what are the gaps when these hospitals come into operation. You're in the system. We have to identify those gaps and start working on a system that will allow us to fill these gaps. As I said, we have a challenge with human resource capacity in the country now. There's a shortage in almost every sector. If there are shortages in the healthcare sector, we have to find short and medium-term solutions whilst we train to meet the future requirement. There is no shortcut to this. It must be planned, structured, and targeted. And all of us must be part of this decision-making or idea development forum. Outside of the regional hospitals, of course, we have the New Amsterdam Hospital that will be more than a hospital, it will be a teaching hospital. We're collaborating with the University of West Indies School of Medicine to have the UE School of Medicine attached to that facility. We have 2 schools of nursing that are under construction. And if we can deploy your skills, if there is a training certificate that we can give, especially our junior doctors, that allow them also to lecture in a nursing program or lecture in other programs, then we want to do that. We want to upgrade your skill set and allow you to be part of this program so that it adds value and we build more local talent, more training of trainers. We want also to look at key assets that we can train in healthcare administration, healthcare management. These are key things that we want to do. The healthcare management information system will come on stream. The patient management information system will come on stream. All of these things would impact your profession, impact the way you deliver service, and improve the transparency in which services are delivered. Of course, this brings a greater responsibility on practitioners because everything will be system-based, rule-based, and information-based. That is how decisions will be made. That is how evaluations will be done. That is how investigations will be supported when this comes into existence. The Children and Maternal Hospital, we have to prepare. I want that to be managed by our local capability as far as possible. We have to identify what are the gaps, knowing the level of service that will come with that facility. What are the gaps now? And ensuring that we provide the training, the adjustments in the system, so when that facility comes into existence, we'll be ready. I also want us to take a few key persons from the system and attach them under the ITEC program in India and attach them in China to state-of-the-art facilities so that they can have an opportunity to spend a few weeks working in similar environment so that that transfer is smoother, that transfer is more structurally integrated into what you're doing. So I said that my intervention would have been brief. I've already extended beyond brief. Now, for anyone to say with a clear conscience that they have not seen monumental changes in the healthcare system, even in the salaries of healthcare professionals, then they'll be doing an injustice to their conscience. A serious injustice to their conscience. The objective of this meeting is how do we move to the next level? under the initiative with Mount Sinai, we are addressing some key areas. The National Child and Youth Healthcare System, where we are targeting, we have already done comprehensive screening and analysis of 11,224 nursery 1 and 2 children across the country, and we are targeting 87,000 children this year across the country. Now, whilst this screening is taking place, because we want to build a healthcare system that allows us to track the health of our citizens from birth throughout their life cycle. That is the system we're developing. We never had baseline data. We are now developing baseline data. So we have this screening taking place. Of course, when you launch such massive screening program, there will be implications for you because you're going now to look for problems. You're not waiting. We're going now to identify problems in the system and fast forward those problems to the healthcare system to be dealt with now. So that's one of the initiatives. The second initiative is the National Primary Care System Strengthening Initiative, where presently we have 400 physicians who have completed training, some of whom are still in training, and we will be launching a national campaign soon. We'll be developing the comprehensive adult primary care expansion program, including the initial care guidelines, and this will be launched nationally also. At the Georgetown Public Hospital Corporation, we are working on the Quality Improvement and Operations Strengthening Initiative, looking at clinical services, Quality and Safety Improvement Program, Hospital Operations and Improvement Program. Then we have the Pathology and Diagnostic Service Strengthening Initiative that is ongoing. The new path lab has been launched. We're now training staff, more staff. We're working through this initiative on the Health Workforce Planning and Development Initiative, and that is what I spoke about, doing a comprehensive analysis of the health workforce across the country, doing that gap analysis and aligning our training program and our planning program to bridge that gap. So we have the Workforce Planning and Analysis Program. We have the Nurse Assistant Curriculum and Training Program. And then we have the ESL for Health Training Program. Of course, we are also thinking about the future, and we have a specific program to deal with language barriers and training in language. We then have the National Health Information System Strengthening Initiative, and that is a National Information System Development Program, the Health Information Workforce and Governance Program, the Citizen Health Mobile App Development Program. This is a mobile app that we want to develop for citizens, attach that app to the functionality of the ID card, basic healthcare information system, electronically available, so that will improve efficiency. Then the Health Communication Strengthening Initiative. This deals with healthcare, education, and so on. So these are some of the things that we are targeting under this program. The final issue I want to address is in the system we have a number of doctors who are trained in Cuba. So you have the added advantage of being good at Spanish. We want now to align your capability with the nurses and doctors who are Spanish speaking in the system, so that we will have, if you have a hospital with 10 Spanish speaking nurses and we have 2 doctors who are trained in Cuba, we then develop a core group with those 2 doctors so that we have better communication channel and better support in terms of the capability that they bring, but ensuring that that capability is not hindered because of language gaps and language challenges. So in a nutshell, I mean, I don't want to go through all the things that we're doing across the country. You know that. Outside of that, you know there are a number of legislations that you have to get yourself acquainted with. And I want you to understand this. I'm asking you to read the legislations, read the draft, understand the legislations. You have the Nurses and Midwife Act. These are legislations that were passed. You have the Radiation Act, the Mental Health Promotion and Protection Act, the Suicide Prevention Act, the Tissue Transplant Act, the National Data Protection Act. These are all new laws and acts that affect your professional responsibility. And I'm asking you to read these pieces of legislation. The legislation that we have now in Parliament, or are on their way to Parliament, are the Telemedicine Bill, the Medicine Bill, and the Public Health Bill. Those are the three bills that will go to Parliament now, that are very important in the building out of this national healthcare system. Now, the telemedicine bill is not only internal, because we are looking now to link our hospitals, link our surgery rooms with robotic facilities outside of Guyana, whether it's in the US, Mount Sinai system, Northwell system, in India, so that we have not only availability of more specialists to guide us and to work with us, but we have now the opportunity to do training programs and for you to get more acquainted with different technology that would aid your work. As we build out the system, we'll move also to robotics. So that will be another area through which we want to concentrate and align training, because that is the future of healthcare delivery and the advancement of our healthcare system. So these are some remarks I want to share with you, but I want all of you to go back, because we would have had to bring everybody out of the system here, to go back with your department, to have this discussion, and for us to feed back into the system all that we can do to align what we're investing in with where you are now. So I want to thank you. We'll now go into the closed session, and I will kindly ask the media if they can withdraw at this point. Thank you.